Hi, welcome to Stay Healthy Doctor Talk Facebook Live program from Bumrungrad International Hospital. Today we have our urologist Dr. Teerapon Amornvesukit from Bumrungrad International Hospital, and he will talk on the cutting-edge prostate cancer treatment. Get your facts right. And I, Dr. Zani Min, Senior Coordination Physician, will be co-hosting this Facebook Live today. Before starting the Facebook Live session, please allow me to introduce Dr. Teerapon's educational background and clinical experience first. Dr. Teerapon graduated his MD from Faculty of Medicine, Sirira Hospital, Mahidol University, Thailand in 1993. He completed Diploma of the Thai Board of Surgery in 1999 and Diploma of the Thai Board of the Urological Surgery in 2001. He received training in laparoscopic and robotic urologic surgery in both Japan and USA. His special clinical interests are in laparoscopic and robotic urologic surgery, endosurgery, laser prostatectomy, and urologic oncology. He has more than 20 years of experience in performing laparoscopic urologic surgery and more than 15 years experience in performing robotic urologic surgery. During Facebook Live session, you are welcome to ask questions in the comment box, and we will try to answer your question at the end of the live session. สวัสดีครับอาจารย์ Teerapon. Yes.
สวัสดีครับ
So today your topic will be on the prostate cancer. So most of the people know that like prostate is important and very important in the man, especially in his sex life and also the urination symptoms. So, but some may not know that where it is located and what are its functions. So could you please explain about what is prostate glands and its functions first?
Yeah. Prostate is an internal male organ located inside our pelvic bone. Okay. When we was young, the prostate size around walnut size, but we are getting older and older. It can be increasing bigger and bigger size to lemon or to orange size. Yeah. And the function of the prostate produce milky liquid to mix with the semen. Okay, when for the ejaculation, it make a milky semen. The prostate located under the bladder and wrapped around the proximal part of the urethra. So the urethra pass through the prostate. So when the prostate is getting bigger and bigger, it may compress the urine flow.
Yeah. So some people are afraid that if the prostate is enlarged and like they are afraid that it will turn into the prostate cancer. So whether it is like related to the enlargement of the prostate gland and the like getting prostate cancer.
Okay. Many patients, this is very good question. So and common questions. Many patients think that the enlarged prostate can change or turn to prostate cancer. So the prostate enlargement and prostate cancer is totally different disease. So it cannot turn to each other. Prostate enlargement cannot turn to prostate cancer. It's different, but it can represent in similar symptom or similar urinary symptom that the doctor have to differentiate which one is cancer, which one is not cancer.
Okay. So in terms of prostate cancer, like what are the risks of like getting prostate cancer? So people may want to know like who is increased risk of like getting developing prostate cancer.
Okay, first of all, prostate cancer is one of the most common cancer in men, aging men. Okay, it could be found around 1 in 7 men in America. It's quite very common. The risk you asked about risk.
Yes, risk.
Risk factor of the prostate cancer is number 1 is age, more than 50 years old. The second, the rest is race or ethnic. The highest chance found in African American race, and to American, Hispanic, and the rest is Asia. The third risk factor is familial history of the prostate cancer, especially his father, his brother has prostate cancer, is more chance to have a gene or genetic hereditary to have a cancer gene. And the last one, the obesity is some increased risk of prostate cancer. Thank you.
Yeah. So how about in terms of diet, Kapachan? So like which diets are prone to have prostate cancer, and like which diet we can prevent like getting prostate cancer?
Okay. Regarding the diet of food that the patient should avoid, because it's related with many cancer, including the prostate cancer. We should avoid red meat, processed meat, okay, and food that is friendly for prostate. You should take it. The first is tomato, okay, salmon, vegetable and fruit, including superfruit, many superfruit, goji berry, pomegranate, broccoli, okay, including olive oil, okay, sesame seed. Okay, this is a good food to take. It's not only for prostate cancer, but it helps for many cancer.
Yeah. So like in order to avoid so like it is important to avoid red meat and the processed meat, like.
Of course.
Yeah.
Okay.
I see. Okay. So for the, like as you mentioned, like 50 years old, over 50-year-old, they are like the risk of having prostate cancer is increased. So how can prostate cancer be screened, Kapachan?
There are 3 groups of prostate cancer that we get. Okay, the first group, no symptom at all. They come from checkup. The second group, they have some urinary symptom. And the last one is the patient come with distant spreading. Okay, the first group, they come for checkup. 2 kinds of checkup. We check digital rectal examination. Okay, the prostate can feel by digital rectal examination. We can feel the lump or hardness of the prostate. Okay, the second, we check the blood to check the PSA. Okay, normally we use a physical exam or DRE plus PSA is a basic test.
Yeah. So like you mentioned 3 groups like that can be screened. Yeah. Yeah. So I would like to ask. You mentioned about like the one that can be screened. Mentioned about the abnormal symptoms. So I would like to know what are the abnormal urinary symptoms of the CA prostate cases.
So the first group that I told is for screening without symptom. We screen after 50 years of age or after 40 years of age when they have a familial history of cancer. The second group, they have some urinary symptom. Okay, the urinary symptom of the prostate cancer is difficult urination. The patient sometimes have to push to urinate, or the urine flow is slow. Sometimes they feel not complete emptying. They feel residual urine when after they finish urination. More frequent urination at night and blood with urine. Okay, so this is a common urinary symptom of prostate cancer, very similar to prostate enlargement. So with the urinary symptom, sometimes we cannot differentiate which one is benign or benign enlargement, and another one is cancer.
Let's see.
And the last one, the last one, the last group, the patient have an advanced disease. They come with bony metastasis or bone pain. The most common site of the metastasis is a pelvic bone, hip bone, backbone. So they come with bone pain. Thank you.
Yes. So if a man is found to have like suspicious of having prostate cancer, like what would be the next steps?
Yep. Okay. So the next step, in case of the patient have abnormal digital examination, we found lumps or hardness or irregularity of the prostate or rising PSA. Okay. The next step, the doctor have to discuss with the patient that there's the chance of prostate cancer. The next step, now we know that Mpmri give us the very good information in the prostate. Mpmri of the prostate can check the lumps inside the prostate and tell us the possibility to have prostate cancer. And if it's a high chance of prostate cancer or high PIRAT score 4 or 5, we're going to discuss with the patient to take the prostate sample, or we call prostate biopsy. With the Mpmri, we can use the higher technology to sample the prostate, needle sample the prostate, more precise, high accuracy to get the sample, better than random sampling. Yeah.
So this Mpmri is the new and the latest technology available in our hospital, Bumrungrad.
So we available of Mpmri, including Mpmri fusion prostate targeted biopsy. So it's more and more accurate.
Yeah. So what is the advantage of Mpmri fusion biopsy over like our usual like ultrasound guided biopsy?
Okay, very good question. First of all, we have to know that PSA, rising PSA is not very good, not very good test, but we still use it. Has been used for around 30 years. The PSA is a high false positive rate. Many things, many problems, many conditions can cause rising PSA other than cancer. For example, prostate infection, prostatitis, urinary retention, endoscopy, urinary infection can cause a rising PSA. Okay, so PSA is for screening but not very accurate. MRI can provide us more information, can see the lumps or mass, suspicious mass inside the prostate, and it can provide us clinical significant prostate cancer. As almost everyone know that the prostate cancer sometimes is like a cat, sometimes it's like a tiger. Prostate cancer, some patients have very low risk. Prostate cancer is behave like a cat, so it's very slow growing. Many patients die with cancer, not to die from cancer, but others is prostate behave like a tiger. It's aggressive, invasion, spreading, and can kill you. So Mpmri can detect significant prostate cancer that lead us to get the sample and a biopsy.
So Mpmri is like more precise, like the precision is better than the ultrasound guided biopsy.
Yep. And some area of the prostate cancer is difficult to get the sample, especially in the center of the prostate or in the anterior part of the prostate is difficult to get the sample. So for the general ultrasound guide biopsy, normally we take sample in terms of a random biopsy. Yeah. But normally random biopsy, we random in the back for posterior part of the prostate.
Yes.
This is the most common part of cancer in that area. But at least 30% is not the posterior part, is lie on the other part of prostate. So MRI help us to locate the cancer and precise getting the sample.
Yes. Okay. So earlier you mentioned about like some prostate cancer type are like a tiger,
Yeah.
like very like rapid growing and like reach to the other area. So how can we know that like the prostate cancer is already spreading, and also like to know the staging of the prostate cancer? Like what are the technology available here, and also what we need to do in order to know like how much the cancer is spreaded already?
Yeah, very good question. So after we prove or we biopsy and that shows prostate cancer, the next step we have to know that where it is in the prostate, is spreading to the lymph node, or it have a distant spreading. So to get the staging of the prostate cancer, we use the first is MRI that I told you, okay, and the second one is to check the distant spreading. We check a bone scan to check for bony spreading, or the more or the higher sensitivity is the PET scan.
Yeah. So bone scan and the PET scan like can see the spread of the prostate cancer. Yeah, I see. Okay. One we mentioned about the role of surgery in the prostate cancer. So like which stage has the role of like surgery for the prostate cancer?
Yeah. Okay. Prostate cancer generally for easy to understand.
Yes.
Okay. Simply, I divided the prostate cancer in 3 groups. The first group is stage 1 or stage 2, or normally I call it localized prostate cancer. Localized prostate cancer means the cancer contained inside the prostate, not going out of its margin. So localized prostate cancer, the first group. The second group is locally advanced prostate cancer. It goes through the prostate capsule, okay, but not have distant spreading.
Yes.
Just going out through the prostate gland.
Yes.
And the last group is have a distant spreading to your body, to your bone, distant spreading. Normally, I divide in 3 groups.
3 groups, yes.
Okay. That have a different treatment in 3 groups.
3 groups, yeah. So which group have the role of surgery?
Okay, good question. The surgery, normally surgery we call radical prostatectomy, okay, which have done for at least half a century.
Half a century.
Yeah.
Already so long.
Radical prostatectomy have a role in first group, localized prostate cancer. The cancer is inside the prostate gland, and the second group is just invade outside the prostate gland, no spreading. Okay, so it's prostate. The surgery have its role in the localized or contain the cancer, or it's just going out from the prostate gland.
Oh.
Yeah.
So, like when the cancer is already spreading to the other distant area, so there is no role of surgery anymore.
If it's spread, have a distant spread,
yes.
okay, there is no role to do radical prostatectomy. Yeah.
Okay. So when you mentioned about radical prostatectomy, like which organs are removed during the operation?
Okay. To do a radical prostatectomy, what organ we remove? We have to remove the prostate gland totally, okay, including the seminal vesicle or sperm bags. And if indicated, we have to remove the lymph node, okay, so surrounding the prostate in the pelvic area. We call lymphadenectomy. Yeah. After we remove the bladder and the urethra, we will reconnect each other, yeah, to have a connect urine flow. Yeah.
So, in order to do radical prostatectomy, there are like how many approach available, Kabajan?
Yeah. Okay. For the evolution of surgery, okay, almost a half century, radical prostatectomy, we do open surgery, like many organ. Open surgery, we made an incision under umbilicus, low abdominal incision, to open widely, and the surgeon and the assistant will go through this wound to remove the prostate gland. Okay. Anyways, the prostate is very deep organ and far to reach. Okay. Around 30 years ago, the evolution from open surgery moved on to the keyhole surgery. We call laparoscopic radical prostatectomy. Okay, we make a small hole, 5 mm to 1 cm, make a hole, keyhole, and put the small instrument into that hole.
Yes.
Okay, to remove to remove the prostate the same fashion like open surgery. The laparoscopic way make a much less pain, less blood loss, and improve the recovery of the patient. And the latest one is a robotic or Da Vinci approach, okay, which has been done since 20 years ago, around 20 years ago, yes, the year 2000.
Yeah.
Okay, we use the same surgery as laparoscopy, okay, through the small hole, but the tip of the instrument have a wrist. Yes, it's very important when we do painting, drawing, or do surgery. We have to have wrist joint to do meticulous surgery. So the robotic surgery, the surgeon have to perform control the robot, and the robot is my assistant to do surgery as I move. When I move, it's move. Have a wrist joint to do the meticulous surgery. The robotic surgery have its less invasive way, like laparoscopy.
Laparoscopy, yes.
Less blood loss, less pain,
Less pain.
faster recovery, fewer complication, yeah, and earlier recovery of the continent function and sexual function. Okay, nowadays more than 90% of radical prostatectomy in USA have done by robotic way.
Robotic way, yeah.
Yeah, and nowadays I think robotic surgery have done in patient more than 7 million patient until now, more than 7 million. So it's very common,
yes,
and widely accepted.
Yeah, because like the advantages are over the open surgery and also like more than the laparoscopic surgery. Yeah. So nowadays robotic surgery is widely used. Yeah, but like some people, they may misunderstand that like robotic surgery, when we mention about robotic surgery, they may misunderstand that robot is the one who performed the surgery. So could you please?
Yeah. Many patients ask me, oh, doctor sleep at home and let the robotic do the surgery.
Yeah.
Oh, no. The surgeon control, during the surgery, the surgeon control the robotic arm, and inside the patient is move, the robotic move the same as I move. Okay.
Yes. Okay.
And more precise than our hand, because it's have the prostate surgery is very deep organ. Okay.
Yes.
with the magnification view, 3-dimension, the magnify is magnified at least 10 times. So the prostate is very big, and when we preserve the nerve, when we stop the breathing, when we stitch to connect the bladder with the urethra, is more meticulous than other way. Yeah.
So there are a lot of like benefit from the robotic surgery, like more precise and also less pain, blood loss as you mentioned, and also the complication rate also will be lower than compared to the open and laparoscopic
correct,
surgery.
correct,
Yes.
absolutely.
I see.
And to preserve the prostate have a nerve for erection. Okay, the prostate have two nerve for erection, left side and right side. Okay, when the cancer is far from the nerve, we are going to discuss with the patient to preserve the nerve, that nerve. Okay, the robot can preserve the nerve very fine.
Yes.
Okay, that make the post-operative recovery of the sexual function is earlier than other approach. And in case of when we stitch the bladder with the urethra, is fine stitch.
Fine stitches.
Okay, that make a earlier continence, less incontinent, less urine leakage than other approach.
Yep. Yeah. So even after surgery, if we spare the nerve, and then the patient can enjoy their sex life after recovery. Right?
Yeah.
I see. Okay, so there are a lot of benefits and advantages of the robotic urologist and robotic radical prostatectomy, robotic surgery. Yeah. And so after the surgery, like what would be the recommendation for their follow-up plan in terms of like their sex life and also like diet and also their lifestyle, like how they should avoid or like what they should do, ครับอาจารย์
Okay, as I told, the patient should, after the surgery, normally many of my patients, 2 weeks of surgery, they can do light exercise. For example, swimming, putt golf, and almost a normal slow life, but low degree of exercise. Have healthy food, okay, and after 1 month they have the almost the same as before surgery. But in terms of recovery of the sexual function, is in case of we preserve the nerve, okay, many patients have has to be informed that the recovery of the erection is gradually. So I normally prescribe some medication, okay, for example, tadalafil every day to improve the blood flow, to improve to make an early recovery of the sexual function.
Yes.
After surgery, every patient have to be taught to to exercise the pelvic floor or Kegel exercise. Okay,
yeah.
to make a sphincter stronger and stronger. Yep. It's every patient have to be informed and to be taught.
I see. Okay. So like in our Bumrungrad, like we have the urology department, and also like what is our highlighted area of Bumrungrad International Urology Center, because most of the patients they would like to come for the prostate cancer treatment, and then they don't know where to choose, and then like what would be your advice for
Very good question.
ครับอาจารย์
Okay, that why to come
why to come Bumrungrad, why to choose Bumrungrad,
why to come here?
Yeah.
Okay, I think first of all, Bumrungrad have a multi-disciplinary approach. We have experienced surgeon, experienced urologists, We have high experience radiotherapists. We have very high experience oncologists. We work together
Yes.
to choose the best treatment for each patient. Okay, I think it's the most strength, the highest strength
Yes.
here. The second one, we have we can diagnose precisely. We're using the high technology to investigate, for example, Mpmri prostate, MRI fusion prostate biopsy.
Yes.
That I previously discussed is very precise and higher is very precise to target to
yes,
sample. Correct diagnosis is very important for the patient.
Yes.
Okay. The third one, we have a high experienced surgeon, urologist, to perform robotic surgery in case of the patient make decision to do surgery.
Yes.
Okay. We have pre-operative, intraoperative, and post-operative teaching.
Yes.
And discussion and program to make the patient pass easier, pass this process easier. Okay, that make the patient have a higher result.
Yes.
With the best result.
Yes. And how about the radiation coverage?
Okay, I will tell you roughly about the radiation. So radiation have a significant role in prostate cancer. Okay, in general, radiation have two kind of radiation. The first one, we put the radiation inside the prostate, inside out. That we call brachytherapy.
Brachytherapy, yes.
Okay, brachytherapy. We have everything here.
Yes.
The second one is external beam radiation.
Yes.
The radiation come from outside and focus to your prostate and lymph node.
Yes.
Okay, we have a high standard radiation, both brachytherapy and radiation machine.
Yes.
Yep.
I also learned that we have the genomic study here in Bumrungrad. So for this new technology, how can we help our CA prostate cases?
The most important thing I forgot to tell. Thank you for asking me. Not only surgery, not only radiotherapists, not only oncologists, we also have a genome or gene test. Okay. Now gene test is very important.
Yeah.
We have the gene test for prostate cancer have benefit on both patient and their offsprings.
Yes.
If the patient tests the genome, okay, they can have the doctor can choose the best treatment.
Yes.
To treat that patient. And also they check their offspring. They will know that any daughter or their son have carry the abnormal gene, which can make cancer in future. We will have a program for checking specifically each patient or each their offspring.
Yeah. I see. So there are a lot of benefits and also like a lot of options that we can offer to our patients better. Yeah. So that like we have like one-stop service, and then we have a lot of options in order to treat that particular patient. Right? Yeah. So I think now it is time for a Q&A session. So let's see what questions are asked in asked by our audiences. Okay. The first question is like, my father is 79 years old, has to wake up urinating 4 to 5 times every night. Is that the sign of prostate cancer? Must he need a surgery?
Okay, very good question and very common question during the daily practice. Okay, patient 79 years old.
79 years old.
Wake
and
up 4 to 5 times
every
at
night. Yeah.
Okay. Or the first, there are dozens of causes that the patient have nighttime urination. Dozen causes. The common cause of nighttime urination. Okay. The first is a benign prostate enlargement. The second one that I told is a prostate cancer. The third one is a general medical condition. For example, diabetes can make a kidney produce more urine at night.
Yeah.
Too much water drinking before bedtime produce urine.
Yes.
Chronic kidney function or kidney impairment can make a more urine production, more urine flow at night. Heart failure or the impairment of heart pumping. Okay, the patient during the daytime, the heart patient have a fluid collection under our skin or fat. Okay, when they sleep, this fluid excess will go to the bloodstream and make the produce the urine. So there are dozens of causes for the nighttime urination. It is important for a doctor to have a history, physical examination, and investigation to prove that which one is the correct cause of nocturia, or we call nocturia.
I see. So, like the patient needs to be assessed, like needs to have like investigation first in order to identify the real cause of like frequent urination.
Many patients have not one cause, it's a mixing cause, two or three mixing causes.
Yes.
Some patients have obstructive sleep apnea. They woke up at night and go to urinate. We have to prove that what is the actual cause.
Actual cause, yes.
Yeah.
Okay, the second question is how many days hospital stay for prostate removal surgery? How many days like he needs to recover, Kamachan?
Oh, okay, common question again. Normally, we during the day of surgery, we perform surgery around 3 hours. Okay, and after the surgery, we just waiting for they have normal food. Okay, after surgery, almost every patient will have bloating. Okay, 1 or 2 days later, the patient can have food.
Yes.
Normally. Okay, we remove the drain at the next day or the next day. And normally we discharge the patient with catheter. The last one that we remove is the urinary catheter. Urinary catheter have to be placed around 7 to 10 days. And after 7, normally patient will be discharged 2 or 3 or 4 days, and you come back on the day 7 to day 10 to remove the urinary catheter. We have to wait because of you have to stitch to connect the bladder with the urethra. We wait. We have to press a catheter. If the stitch is secure, we remove the catheter and let the patient urinate himself. Yep. And for the recovery that I told, 5 to 7 days, the patient can walk around, help themselves. Okay, and around 2 weeks after surgery, they can swimming, they can putt golf, they can walk fastly, but not big exercise. After 1 month, they can do more and more exercise to reach their capacity.
Yes. And the other one is asking, what are the early warning signs of prostate cancer?
Good question. That I told you, the first, many patients now it's time to, every doctor, every patient want to know the prostate cancer very early, not late. So the first is screening, checkup. Okay. Checkup is very important. No need to wait until the patient has severe symptoms. Okay. The patient after 50 years old, male patient after 50 years old, they can come with check.
Check.
Okay, digital check of the prostate
Prostate.
plus PSA check. The second one, when they have symptom, urinary symptom, frequent urination, slow urine flow, difficult urination, nighttime urination. Okay, is an early sign of prostate cancer. They should to see the doctor. Okay, the doctor will help you to check what is the actual cause of the problem.
Yeah. So you mentioned about over 50 years, like should come and check for the digital rectal examination and the PSA. So how often do they need to check, if the result is normal?
If the result is normal, annually.
Annually.
Okay. Or if the patient have a familial history, his father, his brother have prostate cancer, they should come earlier. Start at the 40 years of age.
40 years of age. Yeah.
Okay. If it's normal, annually.
Yeah. So another question is, how is life after prostate removal? How is life? Like I'm not sure whether he means about sexual life or
Okay. What the patient will find after prostate removal? The first, they have no sperm. The prostate produce and is the way of the sperm. So the patient have no sperm at all. The second, in case of the doctor, the surgeon, preserve the nerve preservation to preserve the erection.
Yes.
Okay. Every patient that before surgery we discuss with the patient, if we preserve the nerve for erection, both sides, the chance to get erection, around 7 to 80%, with or without Viagra or something like that.
Yes.
When we preserve only one side of the nerve,
yes.
Okay, the chance to get erection around 40-50%. If the cancer is very close to nerve, both sides, and is dangerous to preserve the nerve, we're going to discuss with the patient, is too much danger to preserve the nerve because the cancer is close or attached to the nerve. So we have to cut widely and further, so the nerve become not preservation. The patient will not get erection.
Yes.
But anyways, after the surgery and the surgery went well, if the patient want to get erection in case of not nerve preservation,
yes.
Okay, we can refer the patient to another patient who put penile prosthesis. Okay, penile prosthesis is a prosthesis to put inside the penis. The patient can get erection on demand.
Yes.
Yeah.
See. So another question: is it better to have prostate removed or like receive radiation?
Oh, okay. Surgery or radiation is a viable option. Okay, nothing is better than one. It depends on the patient. Okay, so the patient have to discuss with the doctor team of the doctor. Okay, so normally for localized prostate cancer, localized means the cancer inside the prostate, the result survival rate approach 100% in 10 years. That means do treatment surgery today, next 10 years 99 or 100% still survive. Very good result. As the radiation, the same. Okay, but it's different in side effect. Okay, if the patient healthy enough or concerned about something. Okay, for example, the patient has a previous surgery inside. Okay, to do repeat surgery is much more difficult. So sometimes, or the patient cannot do surgery because of their own function or heart problem, serious brain problem. Okay, serious heart problem. Cannot, the cardiologist tell us high risk to do surgery. Okay, we move to radiation. Okay, but the benefit or result, survival for localized prostate cancer is the same, high is the same, but different in terms of long-term side effect.
Yes. So I see, like in order to choose the each option will be depend on the patient factors and will be decided
Each patient
after
Yeah.
each patient. I see.
tailor-made.
Yeah.
Yeah.
Another question is, does having prostate removed shorten life? So like if we remove prostate, it will shorten our life or not, ครับอาจารย์ Whether if the prostate removed, it will affect to our life expectancy, ครับอาจารย์
The life expectancy depends on the stage of cancer. It's not depends on the prostate
surgery.
present or not present.
Present. I
Okay.
see. Okay. Another question is, are there any complication after surgery, ครับอาจารย์
Okay. Every time we discuss before surgery with the patient, is the possibility of the complication. The first is severe bleeding that require blood transfusion. This is very, very low, very, very low. Okay. The second one is urine leakage, very low as well. Okay. The third one is rectal injury, 2% chance of rectal injury, especially because of the prostate gland attached to the rectum, very close to the rectum. Okay, and the doctor have to do a meticulous surgery to preserve the rectum posteriorly and to remove the prostate. In case of the cancer is very close to rectum or invade the rectum, so we have to remove the rectum and repair the rectum. So it's chance around 2% of the rectal injury that we already have to discuss with the patient to know about that. Okay, other complication is similar to every kind of surgery. For example, venous thrombosis. So we have a prevention measure.
Yes.
Okay, normally it's not a big problem.
So another question is, how to stay safe from prostate cancer?
Oh, how to stay safe?
Yes.
Difficult question. Okay, the first we call healthy life.
Yes.
Healthy life, healthy weight. You have to have a good weight. Overweight or obesity have a higher chance of many cancer, prostate cancer. Healthy food, healthy air, healthy food that I previously I discussed about the prostate friendly food.
Yes.
Okay, healthy air, healthy food, healthy mind, healthy weight,
Yeah.
and healthy and regular checkup. I think this is the most important.
Okay, I think the answer. Okay, and maybe like my questions is like like you mentioned about the risk factor for the having prostate cancer. So how about like the risk factor about the sexual like habit or their sexual lifestyle, whether is it related to the risk of prostate cancer?
Okay. There are some study report that regular and frequent sex have the more sex, the lower chance of prostate cancer. But on average, around 5 sexual intercourse a week or more than lower chance of prostate cancer. Okay, let's do that.
I see. Okay, so I think our time is up. So before closing the session, like what would be your take-home messages to our audience?
Oh, take-home message. Okay, prostate cancer is when we detect early, is an excellent result. Almost 100% survive more than 10 years, or or cure. So we have many modality to treat: surgery, radiation, and hormonal therapy. Okay, there are many doctors to choose the most suitable way for each patient. So, thank you.
Yes. Okay. So, thank you very much for all of your attentions and all of your questions. We are sorry if we didn't have a chance to answer your question because of the limited time. So, like, if you have question related to our topics, you can leave the our messages, or you can contact to our referral officers or our hospital by email, and then we will try to answer your questions. And also please stay tuned for our next Stay Healthy Facebook Live program by our Bumrungrad International Hospital. Thank you very much.
Thank you very much.